certified nurse midwife at the University of Colorado Hospital with the Center for Midwifery. Today we will be discussing cord care. After your baby is born, you'll have a clamp like this that is placed on by your obstetrical provider after the cord is cut and disconnecting you from your baby. And typically this will stay on, 1 to 2 days, but should be removed before you leave the hospital. So the clamp is placed on at the time of the birth. Your obstetrical provider, physician or nurse midwife will clamp the cord, and then a family member or the mother or the father will cut the cord, and this is what stays on until 2 days, typically 1 or 2 days after the birth. This should be removed before you leave the hospital. Often families will keep this as a keepsake from the birth. And the most important thing is that you want to make sure that the cord stays nice and clean and dry. What helps the cord dry is just the more time it's exposed to air. The most important thing to do with diaper changing, you want to make sure that the diaper is rolled down so that it is not impacting or getting in the way of the cord. You also want to make sure that the diaper is on tight enough so that no urine or stool can get on the cord as well. Many of the diapers do have a little cutout that helps to prevent any wetness from occurring. If your diaper does not have that cutout, you can just roll the diaper down. While you're at the hospital, your nurse will show you and instruct you on how to care for the baby's cord. And there's not a lot that you need to do. Essentially, you just want to make sure that it stays nice and dry. Things to watch for: if you do notice any redness at the site, any oozing, any odorous discharge, your baby seems to be having pain or discomfort when you change the diaper, you should notify your pediatrician if you notice any of these things. You also do not want to bathe your baby until the stump does fall off, which typically can take anywhere from 2 to 3-ish weeks, and sometimes even longer. So if you feel like the cord is still on there, it's been 2 or 3 weeks, you may want to contact your pediatric provider, but that also can be very normal as well. Depending on the facility of where you deliver, you may be instructed to use alcohol wipes just to clean around the cord at the location of the cord. But this is really facility dependent, and so ask questions of your nurse to make sure that you're taking care of the cord appropriately. You just want to make sure it's nice and dry, and it will fall off all on its own. You don't need to do anything to encourage the cord to fall off. There are things you may notice. Sometimes you may notice a small amount of bleeding in the diaper from the cord. That is definitely normal. Things you do want to watch for are if you notice any redness around the cord, any odors discharge, it's odorous, it's smelly, or if you notice if the baby exhibits any pain or cries when you touch the cord. Those are things that you should contact and notify your pediatric provider. You do not need to do anything to encourage the cord to fall off. Typically what you will find when you go to change a diaper or when you unwrap your baby, you'll notice that the piece of cord is in the blanket or will be within the diaper at some point, and that typically happens around 2 to 3 weeks.